So here at the ESMO meeting 2022, we had an update from the ADAURA study with 2 additional years of follow-up, where all patients had now completed 3 years of adjuvant osimertinib. We had an update both on efficacy and safety. In terms of efficacy, the overall huge impact of adjuvant osimertinib is maintained, with a hazard ratio still in the 0.23 region, demonstrating that adjuvant osimertinib still maintains a big effect size in preventing relapse and death. When we look at the subset analysis as to what's driving that, there are no clear losers from that, and all the different subgroups continue to derive benefit. However, when we look at the details of the stage, things become a bit more complex. We see that in stage 2 and 3A, that there is perhaps a waning effect after we stop osimertinib at 3 years or 36 months, because after that time point we see a slight increase in the disease-free survival events. We don't see that in stage 1B. We don't know whether that's because it's more of an effect in stage 1B beyond discontinuation, or whether there aren't enough events yet because it's a better prognosis tumour. So overall, the study continues to demonstrate a strong benefit. However, there are more events on discontinuation. This therefore raises many new questions. For example, should the optimal timing of osimertinib be for a duration of 36 months, or should there be longer, given this potential waning effect that we're starting to see? And if we are seeing a waning effect, does that mean that osimertinib is actually curing patients, or is it just delaying relapse? We need to have more information with longer follow-up and MRD to understand this. And it also has impact on when patients relapse. We saw in the ADAURA update that there was an excess of intracranial events occurring on discontinuing the drug. Hence, we need to be more vigilant and change our monitoring frequency around the time of discontinuation of osimertinib to be able to capture these events in order that we can salvage them appropriately. I look forward to more data with longer follow-up. I think this will become a bit clearer, but we do really ideally need more outcomes by MRD status. Is it the MRD positive or negative patients that we see this effect in? And what happens when patients relapse? Do they get osimertinib? What is the relapse? What is the retreatment rates, and what's the outcome of that? Lots more questions, but overall, it's still a strong effect.